Berkshire Vaccine Collaborative. I just want to thank Governor Baker and Lieutenant Governor Polito for coming here today, and Mayor Tyer as well. Since we began this collaborative in the middle of January, we've done over 65,000 vaccines throughout the county. This collaborative represents 3 locations in the county, Great Barrington, Pittsfield, and North Adams. This collaborative is comprised of 32 boards of health, the City of Pittsfield, Northern Berkshire EMS, CHP, our local community health center, and Berkshire Health Systems. I would be remiss if I didn't say thank you to those that have allowed us to use their facilities, BCC, Dubois Middle School in Great Barrington, St. Elizabeth's in North Adams. And I'd also want to say thank you to all the countless volunteers that are part of this collaborative and make this possible. We have a wonderful Western Mass Reserve Corps that has provided volunteers throughout the county to make this work very successful. Each of the collaborative locations is able to do up to 200 people an hour. And so we always say each location could do 2,000 vaccines a day. As we all know, there's not enough vaccine supply at the time to be able to hit those numbers. But whenever they do free up, be sure to know that you should come here and look for the vaccine, because we're going to be ready to get them into your arms and move on from this vaccine, from this pandemic. So thank you for your time with us. I'm going to hand the podium over to the governor.
Thanks very much, and good afternoon. It's terrific for the Lieutenant Governor and me to have a chance to be here in Pittsfield, where we just had an opportunity to tour this particular site, which we know is run by local health officials working with the Berkshire County Regional Collaborative. I want to say thank you to the mayor for all she's done, and to Darlene and to the team for their work from Berkshire Health Systems to make this all happen. I also want to give a quick update on how the regional collaboratives are performing, and I also want to give a quick update on vaccinations here in Massachusetts. First, with respect to our daily data, COVID-19 cases, hospitalizations, and vaccinations. Yesterday, the Department of Public Health reported 1,370 new COVID-19 cases. That was out of 77,000 tests. We've now conducted over 20 million tests here in the Commonwealth of Massachusetts, which makes us the second largest per capita testing state in the country. 686 individuals are currently in the hospital. That's down by about 70% from the peak in early January, and about 156 are in the ICU. With respect to vaccinations, over 5.3 million total doses have been administered here in Massachusetts, and over the past weekend, we crossed an important milestone with 2 million people in Massachusetts fully vaccinated. And this past Monday, as most people know, Patriots Day, everyone who's 16 years or older is now eligible to be vaccinated here in Massachusetts. Throughout the course of the past few months, the phased distribution plan that we've used here in Massachusetts has been quite successful in making sure that we administer doses we receive from the federal government quickly, appropriately, and efficiently. We currently rank first in the nation in both first doses and total doses administered per capita among states that have more than 5 million people. That's about 24 states. Over 85% of our residents over the age of 75 have received a first dose, which is significantly higher than the national average, and we outperform nearly every other state when it comes to the percentage of our Black and Hispanic residents who've also received first doses. Regional collaboratives. We've been successful because we've built significant distribution capacity filled with quality, qualified, and capable people who've been able to administer far more doses than they've been able to receive. I say this all the time. I'll be repeating what Darlene said. The simple truth of the matter is we could do 2 or 3 times as many doses here in the Commonwealth on a daily basis as we actually had supply for. And I have expressed on several occasions to the federal government that if they have states that are turning away doses or not accepting doses, we'd be perfectly happy to take them off their hands and make sure that they get used quickly, because we do have very little vaccine hesitancy. I'll talk more about that in a minute here in Massachusetts, and plenty of demand. With respect to dose allocation, this week Massachusetts received about 348,000 first and second doses as part of our state allocation from the federal government. That is basically flat from last week. The distribution among providers with respect to those doses, 122,000 went to health systems and healthcare providers. Regional collaboratives and local boards of health got 76,000. Mass vac sites got 122,000. Community health centers received 22,000 as part of their state allocation. They also get doses directly from the federal government. Retail pharmacies received a small piece of our allocation, 4,500 doses, but that's the share from the state. They get a big chunk from the federal government. Mobile clinics that support long-term care facilities, congregate care, senior housing, and homebound individuals received about 2,000 doses. We continue to abide by the CDC's recommendations with respect to pausing the administration of J&J vaccine until we hear from them. We do expect more clarity on the J&J vaccine soon. Tomorrow, the CDC's Advisory Committee on Immunization Practices, which issued the pause in the first place, is scheduled to meet and discuss the status of that pause. In addition to the state allocation that I mentioned, the federal government has allocated 120,000 first and second doses directly to retail pharmacies and about 69,000 doses directly to community health centers. And the community vaccination clinic at the Hines Convention Center, which is run in partnership with FEMA, was allocated about 42,000 doses. Berkshire County was one of the first areas of the state to pursue a regional collaborative model to vaccinate their residents. These collaborations, as you know, pool resources from local healthcare providers and health departments to create highly efficient operations that can vaccinate residents across a wide geographic area. That's especially important here in the Berkshires, and the incredible work this team has done has paid off. As of last Thursday, Berkshire County reported, it's actually Berkshire and Barnstable County, those two regional collaboratives, the bookends here in Massachusetts, have reported the highest rates of the percentage of population that have received a first dose. Yours is currently at about 45%. I expect at some point in the not too distant future, you'll cross 50. That number will continue to climb now that everybody's eligible, and especially if we can get more doses from the feds. Statewide, regional collaboratives and local health departments account for well over 500,000 doses that have been administered here, and they're in the top 5 types of providers by total doses administered. We've worked closely with the regional collaboratives to make it easier for residents to book appointments online, and this week we're adding 3 new collaborative locations on the Cape to the pre-registration system. We'll continue to maximize our vaccine distribution infrastructure to administer doses quickly, and regional collaboratives will continue to play a critical and important role in this process. Now, before I turn it over to Mayor Tyer, I just want to make one additional announcement about our ongoing public awareness campaign, Trust the Facts, Get the Vax. We launched this $5 million public awareness campaign back in early February to address vaccine safety and hesitancy. And since then, we've augmented that effort with a $30 million vaccine equity initiative, which has been focused on breaking down barriers to getting vaccinations and promoting access and awareness, especially in our disproportionately affected communities. Federal data shows that these efforts are supporting vaccine administration and that a vast majority of the people in the Commonwealth are interested in getting vaccinated. Recently published data from the CDC shows that Massachusetts has the lowest vaccine hesitancy rate in the nation, with all of our counties showing hesitancy rates that are well below 10%. People in Massachusetts are eager to get vaccinated. And in addition to our strong vaccine distribution infrastructure, this enthusiasm is a critical part of making Massachusetts the leading state among all big states in getting our residents vaccinated. Still, we know that not every community is equal, and that we still have a lot of work to do in communities of color, which have borne the brunt of this pandemic in many ways. That's why we've been doubling down on our efforts to ensure people are informed about vaccine safety and efficacy, and to come up with strategies, literally door knocks, pickups, mobile sites, and a variety of other approaches to help them get vaccinated. This week, we're also launching a new round of multilingual TV ads to remind people that the vaccine saves lives, and it is the best way to protect yourselves, your loved ones, your coworkers, and your neighbors. The continuing public awareness campaign will complement the door-to-door canvassing efforts that I previously mentioned in the 20 hardest hit communities, which is well underway. We've made a lot of progress to get our population vaccinated. I think most people know that this is a big part of getting back to normal, and we'll continue to stay focused on providing access to everyone who wants to get a vaccine. And I've said before that even if we don't see much change in the federal supply, we expect that everybody who wants a vaccine will get one, certainly by the end of June. My hope and my anticipation is that we see some improvements in supply, and that particular date can move up by a few weeks. We know we are in a race against time on this one to make sure we get people vaccinated. We continue to deal with new variants that are associated with COVID-19, but I would point out that every day I'm looking at some of the national scoreboards and I'm tracking case counts and hospitalization rates down the East Coast all the way to Florida and across the Midwest all the way to Minnesota and Massachusetts. While we do have a higher case count than many of those other states, that's in large part because we test more, and our hospitalization rate is actually the lowest of all the states, running from here all the way down to Florida and across the Midwest, all the way to Minnesota, which says a lot of the work that people are doing to identify new cases and help people stay isolated and supported are working. And with that, I want to congratulate the folks here again for the terrific job they've done here in Berkshire County, and turn it over to Mayor Tyer.
Good afternoon, everyone. It's really great to be here. And Governor Baker, I was thinking about this morning when you first came to Pittsfield in that moment of panic when we had our first community spread. You came to our city, and you've been with us every step of the way. We are extremely grateful. I remember when we were planning for your visit, I said to Gina Armstrong, the city's director of public health, what are the top 5 things you need the governor and the lieutenant governor to know? And one of those things in particular was we need an MDPH epidemiologist as soon as possible. And I think before you got back to Boston, we had our epi. And that is the kind of responsive, caring way that you have treated the Berkshires and all the residents of Massachusetts. Thank you so much for that. It's also really important for me to thank the incredible collaboration that has existed here in the Berkshires from that day to this. And we're here at the BCC Vaccine Clinic, and it is a true collaboration of our hospital, which has provided extraordinary care to our citizens, those who were the most sick, those who needed a little bit of care, and also providing facilities for testing, and now serving in a leadership role in our vaccination clinics. Thank you, Darlene, for your commitment to the people of our community. It also involves the Berkshire Regional Planning Commission and the public health officials from each of our communities. Without that strong collaboration and sleepless nights and hard work and planning and replanning, we wouldn't be able to stand here proudly to say that we are #1 in the United States. This facility and facilities like it across the Commonwealth have made us #1 in the nation, and it's something to be extremely proud of. We have a bit more work to do, though. We have more people to vaccinate. So thank you to the collaborative effort that all of you have put into this incredible organization. Now, all of us from the very beginning have been hyper-focused on data and science and medicine and learning as much as we can and moving as quickly as possible with every shifting landscape associated with COVID-19. So with that shifting landscape and that constant surveillance of data and assessing the numbers, how many people are positive for COVID, how many have we vaccinated, how many are in quarantine, who's in the ICU, where are the variants, that constant assessment of data is extraordinarily important in managing everything that we've been confronted by. But behind all of that data are people and families and kids and opening our schools and reopening our economy. And as we vaccinate more people, what that means is families can come together more often. Our economy can reopen more slowly. People can get back to the things that they cherish. Travel can open more quickly as we get more vaccines. I think it's also really important to acknowledge that COVID is likely to be part of our human experience now. And so while we've had these extraordinarily important safety precautions in place for going on 18 months now, masking, wash your hands, social distancing, now get vaccinated. As we get through the vaccination process, we'll be able to, we can be optimistic that all of those restrictions that we've been faithfully adhering to will become less cumbersome on our lives, and we will start to resume normal activities that we all cherish and enjoy so much. Thank you so much, Governor, for coming. Thank you, Lieutenant Governor. Having this relationship has been vital to our success here in the Berkshires, and it's a real privilege to be part of this incredible collaboration that exists across the state and here in the Berkshires. Thank you very, very much. Thank you.
Questions for any of us? Well, we've been following the public health data and the COVID data, and we continue to talk to our medical advisory board and to track some of the data that comes out of the CDC as well. We've generally been making announcements on issues around COVID that involve sort of the state of play generally every 2 or 3 weeks. And I expect we'll have some stuff to say before the end of April. But at this point in time, I'm with the mayor. People need to continue to follow the rules and the guidance. As I said, people need to continue to get tested, okay? I mean, a lot of folks have sort of substituted in their own mind the idea that I'm gonna wait till I get vaccinated and I'm not gonna continue to test. Testing across the country has dropped dramatically over the course of the past 3 or 4 months. I'm pleased to say that in Massachusetts, the numbers sort of vary somewhere between 85 and 95,000 tests a day. But if you're around somebody who's tested positive or you've been traveling or whatever the issue might be, there's still a ton of testing infrastructure out there. It's free, it's available, you should take advantage of it. But I think it's really important for people to understand that we are not done with COVID. We will probably not be completely done with COVID for quite a while. We'll probably be talking about booster shots at some point when we get past the point where we all get vaccinated fully for the first time. But I think it's important for us also to move at a pace, which we've tried to do since the first reopening panel by the Lieutenant Governor, to make sure that the reopening process we pursue is one that's consistent with the guidance and the recommendations we're getting from the experts and doesn't create a bounce in the wrong direction with respect to surge and additional cases and hospitalizations. So the answer to that is you're gonna have to wait and see. Yeah. I guess the biggest thing with respect to the rollout generally is I happen to think that the mixed model we've used is the right one. In certain parts of Massachusetts, we used regional collaboratives. In certain parts of Massachusetts, we used just the basic healthcare infrastructure that was already there. In other parts of Massachusetts, we had local boards of health focused on very particular populations that they knew best and how best to get to them. mass vac sites, and community health centers. They have all played an important role here. The overlay of the retail pharmacy program from the federal government, which has really been in many respects the primary push from the feds on supply generally over the course of the past several months, I think has been a really good complement to what the rest of us have been up to and the rest of us have done. But I think in many ways, the biggest lesson I take away from all of this is the idea that one size fits all in any of this makes no sense, because we have 7 million people living in a whole variety of different ways in terms of population density, geography, access to existing healthcare infrastructure, and all the rest. And I think the thing we have to do when we get into a place in a position like this is recognize and appreciate that what works in Eastern Mass is going to be different than what works in Western Mass, than works in Central Mass, that works on the Cape. Can I let some of the other folks who have their hands up ask? Yeah. I can't hear you. Yep. Generally speaking, if folks want to be in the pre-registration system, come on down, but not everybody does. And our message to people generally has been, if being in the pre-registration system is a place you want to play, we'll help you figure out how to get there. But it hasn't been something that everybody has felt needed to be part of the way they did their business. Hospitals are not in the pre-registration system. Community health centers are not in the pre-registration system. Some of the regional collaboratives are, some of them aren't. Some of the local boards are, some of them aren't. The only folks that are absolutely positively in the pre-registration system are the mass vac sites. And again, that's another one where our point of view is we'll work with people to set up models that work wherever they might be in Massachusetts, but we're not going to presume that what works for some is going to work well for others. The other thing I would just point out about the pre-registration system, it's ended up serving in some respects as kind of like a safety net for a lot of people. There's continually been about 1.5 million people who are carried in that system sort of almost every day, but it's a different 1.5 million people as folks have signed up. And we've had about 300,000 plus or minus, probably more now, who have unsubscribed because they got an appointment somewhere else. You know, they set up, they hopped on when they were eligible. It was sort of that thing that they could, you know, wait and see when they would get assigned to a location. But then for many people, they got one at a pharmacy. They got one at a regional collaborative. They got one at a community health center. Their clinician or their hospital called and told them that they could come get a shot there. And so I actually think it's basically playing as kind of a, it's the right thing for some, but for many people, it ends up being where they go if they don't land one somewhere else. Yeah. Yep. Yeah, that's absolutely right. There are counties and there are states that are no longer even taking down the available allocation that's made available to them by the feds. They basically said, don't send us any more. We haven't been able to put the stuff that you've sent us recently to work. That is not what's going on here in Massachusetts. And I have said to the feds, if you folks have states, if you folks have counties that aren't taking the allocation, remember the whole allocation for all of this is a population-based allocation. You know, states, counties, most of the distribution is done based on your population. And if you have folks who aren't taking down the allocation that's being made available to them, we here in Massachusetts would love to have that because we have people who want to get vaccinated, and we have an infrastructure that could probably do 2 times or even 3 times as many doses a day as we do now. And the feds have basically said, yes, we understand and we recognize this is an issue. We haven't figured out what we think is the right answer for it. We're going to continue to press on it. Darlene and the mayor both said they've talked to the delegation about this. I'm going to be talking to folks in the delegation next week about it. I think it's really important if there are parts of the country where there are folks who want to be vaccinated, maybe the feds should think about changing some of their allocation methodologies to acknowledge and represent, to acknowledge that fact and to move it to places where it will get used. Yeah. Can you step forward a little bit? I think with respect to the walk-in piece, part of the reason we've been doing appointment only is the issues around storage, prep, and the potential loss of 2 very sensitive vaccines. Both Pfizer and Moderna require deep freeze, thaw the night before based on the amount of appointments you think you're going to have the next day. It's only good for 6 hours after it thaws. And I think from our point of view, the way to ensure that we really limit the number of doses we actually end up having to throw away, and the number we have thrown away is incredibly small given the number we've actually administered, is to have an appointment-based system. And I think it's worked and worked pretty well for us. We have talked to folks in the hospital community about how a walk-in process would work, but they and we both continue to fill the vast majority of the appointments that we make. With respect to hard-to-reach populations, we were using the J&J vaccine, I think, quite effectively here and in a whole bunch of other places to do mobile-based delivery and to go to where people were. Senior housing, community centers, senior centers. We did a ton of work early on in this with folks like the folks here around homeless shelters. We were the only states in the country that had homeless shelters and mental health group homes and residences, congregate care of almost every kind. And that worked really well. But again, the 2-dose piece for that population can be complicated. So what I would say is I'm kind of waiting to see what the answer is on J&J and what people's attitudes about it might be after the pause, because I think it's a big part of how you get to some of those populations and run a successful walk-in operation. Does anybody who didn't ask one want to ask one? Okay, go ahead. Well, one of the good news, one of the good things about the booster, if there is a booster, when there is a booster, is it's one. All right. Keep in mind that one of the great challenges of this thing logistically and in terms of capacity generally from the beginning has been it's 2. So instead of having the one and done as the primary vehicle through which we deliver this, it's 2 doses. And all of us spend a lot of time talking about how many first doses we get, how many second doses we get, and how many chairs having first and second doses means we need to use, and how long it takes, 8 weeks typically, to get somebody fully vaccinated. If you get into a booster agreement, I think that changes the game a lot. And it changes it with respect to the role and participation of doctors' offices. People could just get them as they get their annual physicals. I mean, there's a lot of other channels that are hard to make available when you're playing this 2-dose game with a deep freeze and you're trying to get as many done as possible. I mean, remember, if we get to where we would like to go because demand stays high and the supply's there, between December 31st and May 31st, we'll have done about 8 million doses. I mean, that's a very different kind of number in a very short period of time relative to what a booster process would look like. I do want to thank, by the way, Senator Hines for deciding to get his vaccine while he was here with us. He's chit-chatting, so he doesn't hear me saying this. And I also want to say, where did Representative Farley Bouvier go? There she is. First of all, it's great to see you. But secondly, I don't know if any of you have seen her 360-degree economic development in Pittsfield video. Is that thing available somewhere? It's one of the coolest and most creative ways to sort of speak to what's going on in a community that I've seen somebody do. And a lot of that work was very much partnership based. And as we get answers on questions about J&J and on supply, we will certainly talk to you folks, because we know that you can do a lot more than you have doses to do at this point in time. And I thank you again for the excellence of the work that you have all done and for your partnership on so many of these. It's a great story. Thank you.